Our friends at Peaks of Health Metabolic Medical Center is all about you. But what does that really mean? Well, Dr. Tracy Leinhart is back to break it down and talk about why what she has is different from other clinics. How are you?
I'm
Welcome
good.
back.
Thanks. It's good to be back.
So let's kind of talk overall picture. How is Peaks of Health different from other clinics that you may see online or may see commercials of? How do you stand out?
Well, I think one of the things we do is we try to get to the underlying cause of disease. I practice full functional medicine, so I kind of call it like Dr. House. I start investigating. So say a patient comes in and one of the biggest complaints we ever have is, I'm tired. It's why? Not, okay, you're getting older. It's, are your hormones working correctly? Is your thyroid working correctly? Is your diet correct? So we start looking at the whole person. Do you exercise on a regular basis? What do you do? Are you exposed to anything? Are you living near an airfield, or what's going on? So we get that entire picture so we can start putting the pieces together. So I kind of put those pieces of the puzzle together and work out what's going on and fix it.
Which I think is a great time to bring up your background and the different medicines, how your practice has evolved as the more education you've had and as more patients that you've worked with, right?
Yeah, I learn so much every year because, I attend quite a few conferences, but I also speak at a lot of conferences. And, instead of just going in and speaking for that 1 hour, I actually listen to everybody else too. So I learned so much new information throughout the years. And it evolves by what I see with my patients. If I start seeing trends of certain things happening, then I start more concentrating and learning everything about that trend. So my patients teach me so much, because if I get that difficult case, I start researching everything about it and starting to find everything about that. So I'm an expert on that particular, scenario.
And I know you listen to your patients. For instance, we talked in an earlier segment about how people were talking to you about acupuncture. So what does Dr. Leinhart do? She goes out and gets an acupuncturist to be a part of your team.
Yeah, exactly. And I start learning about acupuncture, which I didn't know all that much about, so I'm like, okay, is this something that we could fit into the practice, or is this something that would be good for the practice or my patients? And, as I said, they teach me, like stem cells. It's something, I won't do something unless I'm very confident in doing it. So I spent 1.5 years studying stem cells before I actually started bringing them into the practice.
What is all under your umbrella of services that you can provide and patients, how they can get help from you?
Well, we do almost everything. We're, an expert in hormone therapy. We train doctors to do hormones, thyroid, diabetes, chronic fatigue, gut health. So it really depends. Almost anything that's going wrong with that person, they're just not getting what they need from traditional medicine, they can come in and try to find out what's happening. IV therapy, we do even anesthetic therapy in terms of, fat loss, RF, we have the Contour RF machines now, laser machines, vaginal health. So we do almost everything. We run urgent care in our practice for our private paying patients because I'm still board certified in emergency medicine.
Okay.
So it keeps them out of the emergency rooms and in the urgent care clinics for a fraction of the cost. So anytime I can, do those things and finding those underlying disease processes before they ever happen, I think that's the biggest thing we do. Find diabetes before you become diabetic. Find early signs. Like we had one patient recently who we found ovarian cancer, and I'm really sad she has ovarian cancer, but we found it in stage 2. Because we were looking at markers that, she had no symptoms. So those are the things that is my job to find before it becomes the problem, or at least when it can be treated.
And of course, that's eventually going to save money if you treat something earlier. Along the same lines, though, what do people need to know when it comes to insurance or payment or those things? Because that is a big concern of people.
It is a big concern. And while we don't take insurance for my services, we do allow them to try to get reimbursed if they have out-of-network coverage. We do use insurance for any laboratory work, radiology. They know their costs going up front. It's no hidden. They know the cost before they start treatment. So there's no hidden fees whatsoever.
I kind of threw that one at you, but I thought that was something. Maybe that was something people were thinking at home, so I wanted to ask. Well, of course, if you want even more information, Tracy is so easy to talk to, and she will definitely talk with you as well. There's the phone number. There's the website you see on your screen. Of course, we're talking about Peaks of Health. Give them a call. Visit the website today.
It's business.